Excellent. I'm going to now cover your lips with this special sticker drape that I have here. So keep the lashes out of the way as I do the surgery, okay? Are you comfortable? Very nice. You've got the teddy bear nicely strangulated in your hands. Very high. You check the astigmatism and your axis. So we call that a pre-flight checklist. Get it, Kara? Just like I check and recheck you before surgery, this is the way to check that we're all on par. And because of your high astigmatism, I have marked your cornea with my 180 axis. So even though the laser has a tracker, this is one more way for me to be very accurate, humanly, as much as I can. Okay, perfect. Any pain, Kara? Beautiful. So we're doing a technique which, unlike LASIK, we're not making any cuts because of your thin cornea and the astigmatism with the potential abnormal cornea. For us to be strong enough and yet correct everything we want, right?
Yes.
Perfection. Very good. Thank you. Perfect. Here we go. Okay, I need your help now. Can you look at your face? Yes. Even here. Thank you.
Tracker's on video.
Here we go. Kara, look at your blinking light now, okay? Perfect. Very nice, Kara. Now we're going to use the laser. Doing excellent. Very good sensation. Very nice. Excellent. Very, very good. Fantastic. Now, Kara, for some cold fluid. All right. Now, can you see a little bit already?
Yes.
Yes? How do you know?
I can see the light.
Fantastic. Any pain, Kara, throughout the surgery? Super. How exciting is this? Fantastic. Now, do you need some drops? Okay. You put a little contact on your eye so that you heal with this technique. Alright. Let's drop next. Did very well. We are done with both eyes. Look down, Kara. How horrible was that?
The worst part's taking advantage of.
Excellent. You did sign up for the facial, so I'm doing that for you. Here we go. Careful, careful. Nice, gently close. Open up. Here we're all done. It's superb. Sit down. Great. Very good. Yeah, was busy working over there. Yeah. Fantastic. Here we have you up now in a minute. How do you feel?
Okay.
You okay?
Yes. Yeah.
You
Thank
see
you.
a little bit here?
Yes. I can see really good. Thank
That's
you.
your time.
Thank you.
Okay.
So?
Yeah. I can see.
Yeah.
Yeah.
That's good.
Any pain, Kara, at all?
I honestly, like, the worst part was getting my eyelids, my eyelashes taped back, but the whole thing, it didn't hurt at all. It was probably, I think that having the videos of how it works would probably have more people do it, because to me it was more scary not knowing exactly how it goes.
Sure.
And, you know, like that, I would have probably wanted to do it a lot sooner if I knew how easy it was. I mean, I knew it was fast, but I didn't know that how easy it was. I mean, seriously, the most painful part was getting
And
the
that's part of the
taper
facial.
shot.
She asked for the facial. But this technique again is not LASIK, Kara. The concept of this surgery is someone has high astigmatism as you, and thin cornea, we should not do LASIK, the cut technique. And this is a very unique concept where I'm using spherical aberration as opposed to your spectral numbers. And the beauty is I've seen all these patients do so well that I'm blown away with the fact that many patients who are told they are not a candidate, it's an incorrect. It's a fallacy because most doctors only approaching with one surgery.
Right.
Even you can design techniques. And today, as you saw, we have a lot of doctors I'm operating on, attorneys, all of them with complications that they've had LASIK somewhere else. This surgery has the ability to even correct them. Therefore, the Corneoplastique concept is so important.
Thank you.
Congratulations.
Thank you.
Yeah, go ahead, please.
Appreciate
Take a
it.
seat.
Thank
Absolutely.
you.
Go ahead, please. So, great. So, you have a seat here, and then this is for you. Only for my patients and me, because I love candies. Okay, and that's good for your eyes, so have that. So, Kara, we just did your surgery. Everything went very well. Ian, any questions? You got to see the surgery?
Yeah, it was great.
Fantastic. So some post-op instructions, and so we'll go over everything with you. Basically, drops that you have already.
Yes.
Get some rest today,
Yes.
and you're staying in town, so you'll have fun, but rest as much as you can. And then I'll see you again tomorrow morning,
Okay.
post-op, before you leave, and then I'll see you back again in about 5 to 6 days. Okay, right?
Yes.
All right. Wonderful. Congratulations
Thank you.
again.
Thank
A pleasure.
you.
Absolutely.
Okay, you don't want to squeeze your eyes, just blink normally. No showering until Saturday.
Okay.
No lotion, face makeup,
Okay.
hairspray, anything like that for the next 4 days.
Okay.
Okay? And you want to have your eyes protected at all times. I'm
Okay.
going to go over this kit with you. Alright guys, come follow me. Doctor will see you guys one last time before you go.
Okay, I think Rich is ready. You all set? Sure.
Right
I'll take a
here.
look before you go.
See the picture?
Okay, Rich should be. Come on under me.
Yes.
Very good. Let's take a look. Please take off your glasses. So we finished your surgery. You got all the post-op instructions also.
Yes.
Fantastic. I'll take a look. Chin over there, please. And to the bed. Wonderful. Perfect. Very good. That's in place. Looks straight. Excellent. No pain, right?
No.
Wonderful. Again, today, get as much rest as you can.
Okay.
And then tomorrow morning, I'll see you guys in post-op. All right?
Okay.
Good.
Great.
Thank you.
My pleasure.
Thank you.
Okay, they're all done. Andrew, Rachel, they're doing fantastic. Here you go, Kira. This is, make sure you have it on all the time.
Okay.
It's protected to the eye, yeah.
Okay.
And then drops are on time, and I'll see you in the morning. Okay?
Okay.
Congratulations
Thank you.
again. Absolutely a
Thank you.
pleasure. Yeah.
Thank you very much.
Absolutely.
you.
Take it. Bye-bye.
Bye.
Bye, guys.
Good morning. How are you?
Good. Thank you.
Excellent. Today's day 5. Open. Nice and comfortable. Any pain?
No.
Wonderful. Fantastic. Vision's already doing great. Yes?
Yes.
Do you know about the drops, right?
Yes.
So today I'm going to see if you're healed enough that I can remove the contact. Majority of the patients heal by day 5. Here. Open your eyes wide. Yes. Look up to the ceiling. Look at me straight ahead, please. Look down. Perfect. Look up, please. Excellent. Look at me straight ahead, please. Carol, superb. Look down. Skin is all healed. I've got the contacts out. How do you feel?
Better now that the
Yeah.
contacts are
Wonderful. And again, just use the drops. I'll
Okay.
see you back in about 10 days. Vision will keep on improving.
Okay.
Any questions?
Probably driving and like normal
How about starting
activities.
today evening?
Okay.
Yep.
Okay, and then exercise and that kind of thing
Starting this weekend?
this weekend. Okay.
Mainly, you're avoiding infection in public
Okay.
spaces. The healing is so, I mean, I'm thrilled. All of you
Okay.
heal on time on day 5.
Okay.
So now that the contacts are out, basically your new skin is back.
Okay.
So just try and rest, at least for
Okay.
today.
Okay.
Drops go on time and she can then resume all normal activities.
After
Right.
the weekend.
Yep, absolutely.
Okay.
Makeup after the weekend.
Okay.
Again, infection
Okay.
is the main thing,
Okay.
right? Any other questions?
No, that's it.
Garrett, congratulations.
Thank you.
Real pleasure. And
Thank you.
she's doing great already.
Good.
Come on, come with
Thank
me.
you.
Hi, Garrett, how are you?
Good. How are you?
Good morning. Good to see you again.
Thank you.
So excellent. Today we're gonna see how you're healing. It's about what, 2 weeks
2 weeks.
since
Yeah.
your surgery.
Mhm.
Thank you for traveling back. I'd love to see you guys and see how you're doing. Open wide. Lovely. Cornea's all healed. No flaps, no cuts. Beautiful and smooth. Good tear film. Your vision's already 20/20 for distance and near, Kara.
Yeah.
How do you feel?
Amazing.
Yeah?
It's nice not having to put on my glasses in the morning before I can do anything.
Lovely. And any
It's
pain
good.
or anything, Kara?
No.
Fantastic. How was the experience overall, Kara?
It's been really awesome.
Yeah.
Yeah.
Great. Again, my pleasure. Patients like you are often told you're not a candidate
Mm-hmm.
because of your high astigmatism in
Yes.
cornea.
Yeah.
This is where I really feel designing the surgery
Yes.
is vital. And then seeing you like this, where you have no restrictions anymore.
Yes.
There's no flaps, no cuts, and I'm thrilled for you.
Yeah.
Safe travels back. Give my regards to your husband.
Thank you.
All right?
Thank
Yeah,
you.
it's a
Appreciate
pleasure.
it.
Great.
So it's been 2 weeks since my surgery, and I couldn't be more pleased with my results. When I first came in, my eye doctor had referred me to have laser surgery with Dr. Gulani because she told me I had weird eyeballs. I have thin corneas and an extremely high astigmatism, and so I wasn't even a candidate for contacts anymore. So I came in and had a consult with Dr. Gulani, really not knowing what to expect. And I didn't know anything about laser surgery. So when I came in and I spoke with Dr. Gulani, he's very personable and very friendly and answers questions in a way that's very easy to understand. And he started explaining to me that there's more than one technique for laser surgery. It's not just LASIK. So he right there looked at all these images for my eyes and told me his plan for my eyes. And it wasn't just a cookie cutter mold, it was a specific plan to help my eyes be the best that they could be. And now 2 weeks after my surgery, I'm seeing 20/20 both near and far vision. My surgery was painless, it was easy. The longest part of the surgery was getting the numbing drops at the beginning of the day. So I came in and I sat in the chair, and Dr. Gulani came in and he took his last measurements to make sure that his plan was precise. Absolutely nothing would go wrong, and that he could give me the best results. And then I had my numbing drops. I didn't need any medication. Everything was very relaxed. Everyone in the office here was warm and just made me feel extremely comfortable. I went into the OR. The hardest part was looking at the light. And it was over before I knew that it had really even started. So, now a lot of people tell me, or when they ask how my surgery went, and I tell them that it was so easy, they tell me, well, I could never do that. I'd be so afraid to have laser surgery, or I couldn't keep my eyes open that long, or all of these things that were just very fearful. But I never felt that here in this office with Dr. Gulani, and my whole experience was just relaxed and wonderful. And I walked out of the OR seeing better than when I went in. And every time that I come back, Dr. Gulani is the one checking my vision, making sure that I'm doing my drops. And again, I couldn't be more pleased with the results of my surgery. It's freeing me up to do more than I ever thought that I could, and just experiencing life in a completely new way, because I can see without the burden of contacts that hurt or glasses that fall off. And I just am extremely grateful for Dr. Gulani and his staff, and just the amazing care that I've received here.